Brimonidine drops are used to treat redness in the eyes caused by minor irritations like smog, swimming, dust, or smoke. It helps to reduce the redness and make your eyes feel more comfortable. The usual dose is 1 drop in the affected eyes 3 times a day, with about 8 hours between each dose. It's best to use Brimonidine drops at the same times each day to help you remember. Make sure to follow the instructions from your doctor or pharmacist for the best results. Before using Brimonidine drops, make sure to read and follow all the directions on the product package. If you have any questions, consult your pharmacist. Use this medication in the affected eyes every 6 to 8 hours as needed, but not more than 4 times a day. To apply the eye drops, wash your hands first to avoid contamination. If you wear contact lenses, remove them before using the drops and wait at least 10 minutes before putting them back in. Tilt your head back, look upward, and pull down the lower eyelid to create a pouch. Hold the dropper directly over your eye and place 1 drop into the pouch. Close your eyes and apply gentle pressure at the corner of your eye for 1 to 2 minutes to prevent the medication from draining out. Try not to blink or rub your eye. Repeat these steps for your other eye if needed. Do not rinse the dropper and replace the cap after each use. If you are using other eye medications, wait at least 5 minutes before applying them after using Brimonidine drops, and make sure to use the eye drops before eye ointments. Do not use the drops if the solution has changed color or is cloudy. If your condition lasts for more than 3 days or gets worse, such as continued eye redness, irritation, pain, or vision changes, contact your doctor. And if you think you may have a serious medical problem, seek medical help right away. If your doctor has prescribed Brimonidine drops for you, it means that the benefits of using it outweigh the potential side effects. Most people who use this medication do not experience serious side effects. Although it is rare, a severe allergic reaction to this drug can occur. Seek immediate medical help if you notice symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or difficulty breathing. Keep in mind that this is not a complete list of possible side effects. If you experience any other effects, it is important to contact your doctor or pharmacist. For those in the US, you can call your doctor for medical advice about any side effects. You may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects and report them to Health Canada at 1-866-234-2345. Before using Brimonidine drops, it's important to talk to your doctor or pharmacist if you have any allergies. This product may contain inactive ingredients that could cause allergic reactions or other problems, so make sure to discuss this with your pharmacist for more details. Be sure to also inform your doctor or pharmacist about your medical history before using this medication. After applying these drops, you may experience temporary blurred vision. It's important to avoid driving, using machinery, or engaging in activities that require clear vision until it is safe to do so. If you are pregnant, these drops should only be used if absolutely necessary. It's important to discuss the risks and benefits with your doctor before using this medication during pregnancy. It's also unclear whether this medication passes into breast milk, so be sure to consult your doctor before using these drops if you are breastfeeding. Drug interactions can affect how well your medications work and may also increase your risk of experiencing serious side effects. It's important to keep a record of all the products you use, including prescription and non-prescription medications, as well as any herbal products, and discuss this with your doctor and pharmacist. It's crucial not to make any changes to your medication dosage without first consulting your doctor. If this medication is accidentally swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important to keep up with your regular medical appointments and any recommended lab tests while using Brimonidine drops. This will ensure that your healthcare provider can monitor your progress and adjust your treatment as needed. Brimonidine drops are used to treat high pressure inside the eye due to glaucoma or other eye diseases. It is also used to reduce the risk of nerve damage and vision loss. Brimonidine belongs to a class of drugs known as alpha agonists. It works by decreasing the amount of fluid in the eye and increasing the amount of fluid that drains from the eye. This medication is usually used 3 times a day, with 8 hours between each dose. It is important to use this medication regularly in order to get the most benefit from it. Remember to use it at the same times each day. If you are using other eye medications, wait at least 5 minutes before applying them after using Brimonidine drops. The best time to use this medication is in the morning, afternoon, and evening. Be sure to follow your doctor's instructions carefully. When it comes to storing Brimonidine drops, it's important to keep them at room temperature, away from light and moisture. Be sure to store them in a place that's not in the bathroom, and always keep medications out of reach of children and pets. And remember, never flush medications down the toilet or pour them into a drain unless you're specifically instructed to do so. When you no longer need the product or it's expired, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.